really important that we recognize their humanity, which the police failed to see, and our obligation to keep talking about white supremacy and trauma inflicted upon communities of color, and to take action, small or large. We can all do something. Following the leadership of activists from groups and organizations most affected by white supremacy. So we'll take 1 minute now. Thank you. Okay.
May I have the floor?
Yes, and then we go to David for the political update.
I reacted a long time ago to the ongoing massacre of people, Black and white and other groups, by the police thugs, basically. They're not law, they are basically law enforcement, but they're not peace officers. That's because of the mindset which has settled in on the United States as opposed to more civilized country in the Eurocom bloc. Take example from England and from Sweden. If people remember 3 or 4 years back, 3 Swedish officers riding the subway were able to subdue a criminal using nothing but their speech and their persuasive powers. That's because of the mindset that has settled in on all of the police and all of the politicians who are running around in circles. I think we should take an example without reinventing the wheel of how to work. First of all, fire all the police and then reconstitute them as have done in several metropolitan New York areas where, like Camden and upstate New York, they have fired the police, selected those that live inside the boundaries of the town where they're going to patrol, and have them vetted completely. We don't have to hire military candidates anymore. We can turn around and train our recruits as professionals as they do in those countries. And the same thing should apply to our vetting of people in the justice system. The judiciary selection is too political and it's too beholden to many powers that control it. It should be really an objective, determined body, both police and judiciary. Money speaks too much, and there are criminal elements, as we know very well firsthand here in Brooklyn, and money laundering and mafia, all involved in the political process right now under the big tent of the Democratic Party, the Kings County Democratic Committee. All right, that's my little diatribe for this afternoon, but I would be willing to go further into it and explain why judiciary is now not a selective process for professionals, but rather whoever empties up the money that comes into their pocket to the Kings County Democratic charity, so to speak. Enough said. I don't want to take away from our business.
Thank you, Borough. This is something we definitely have to keep talking about as a group, and the actions so far that we've taken for everything, like voting rights, etc. We're following the leadership of communities most affected, and this is a great point. Thank you. David, right? David Goldberg.
Hello, everyone. So I have, I'm just going to talk about some important events that have happened on the political and advocacy front over the past month. One of the biggest is that New York State passed its budget for this year, and it was in many ways a very historic budget. So here to talk about it with my backup is Julio Pena, who has studied the changes in this year's budget in a little more depth than I have.
Hi, everyone. New York State passed a pretty historic budget, $212 billion, which is the largest budget in New York State history. A lot of that is due, in terms of its size, due to federal dollars from the December stimulus and the American Rescue Plan. But in terms of the specific budget, it adds close to $5 billion in new revenue, including $4.3 billion tax on the wealthy, which is the first time it's been increased since 2009. And it also adds two new tax brackets on those earning $1 million or more, $5 million or more, and I believe $25 million or more. It increases corporate franchise taxes from 6.5% to 7.5% on companies over $5 million through 2023. In terms of education spending, it increases state aid to public schools by $1.4 billion this year. As we know, the state and Cuomo has notoriously been underfunding our public schools and has been under a court order to fund, but has not been doing so. And this budget commits the state to not only fund for this fiscal year, but increases that funding next fiscal year by 50% and 100% to the money that the budget is owed, which is pretty historic. It distributes about $4 billion in federal dollars from the December stimulus, as mentioned earlier, to public schools. And school districts are also going to receive another $9 billion in direct aid from the American Rescue Plan. It increases SUNY and CUNY by $56 million. And it increases by 10% the tuition assistance program and freezes tuition at universities for 3 years. Distributes $2.3 billion in federal funds to pay up to a year's rent for tenants in debt to landlords, including $100 million for tenants ineligible for federal funds. As many have been hearing, it establishes a historic $2.1 billion in to an excluded workers fund, which is a cash assistance program for those ineligible from federal relief payments, such as the stimulus payment programs, which is a first of its kind across the country. Something that's not included in the budget, which some folks have been surprised and a little disappointed, there's still no dedicated funding for the Climate Leadership and Community Protection Act. That's something that, New York State needs to step up on if we want to reduce our dependency on fossil fuels and really to tackle climate change. And in terms of healthcare, the corporate immunity that was granted to nursing homes in last year's budget was repealed. And there has been additional spending and increase for healthcare in this budget. So that's the overall rundown of this $212 billion state budget.
And so I have a few more things in my notes because this really was such a big and historic budget. One of the things that I think gets lost when we talk about this budget and the fact that it does raise taxes on the wealthiest New Yorkers, it actually includes a small tax cut for middle class New Yorkers. So people filing jointly who make between $43,000 and $160,000 will see about a 1% drop in their income tax in that bracket, and people filing jointly in the 160,000 to 320,000 bracket will see about a 0.1 drop in their income taxes. What else did? The only other things that I think Julio failed to mention that, I mean, Cuomo was clearly in a weakened position negotiating this budget, which is why so many of these more progressive things passed. He did get some of the things he wanted. So we get mobile sports betting in New York, which does provide us an additional revenue stream that they're predicted of about $500 million a year. So Cuomo did get that. He did not get his casino development here in New York City. One interesting clause in the budget allows the state to withhold 50% of state and federal funds from localities that fail to produce plans to reform their police departments. So this is obviously relevant to how we started our meeting with this. There's also provisions for making broadband internet more affordable to all, and a package to improve patient services in the state's nursing homes. There's a lot in here. There's assistance for homeowners, property tax relief for those earning under $250,000. There's more money for NYCHA. And there's also money to facilitate conversion of like hotels and vacant property into affordable housing, which is good. In terms of what this budget missed that Julio didn't mention, it actually did not include funding for any of the significant programs to combat homelessness. I don't remember their acronyms, but the HAVP and Honda programs are the two big programs the state was looking at for homeless funding. They did not get any in this budget. Yeah, so it was a big historic budget, a lot of stuff going on, most of it good. Okay, does anyone have any questions on the state budget before I move on? All right, so the legislature didn't sit on its laurels after passing a budget. It passed two other fairly major pieces of legislation in the past month. It passed the Halt Solitary Confinement Act. And so that was an act to basically limit the use of solitary confinement for all incarcerated persons to a maximum of 15 days. It also implemented alternative rehabilitation measures, including the creation of residential units for rehabilitation in. It expanded the definition of what counts as solitary confinement so that prisons can't get away with something that is basically solitary confinement that isn't. It also basically just establishes guidelines for what humane conditions are when someone is in a solitary confinement area. Oh yeah, and we also legalized marijuana. That's not to be forgotten. So yeah, I mean, basically, unless you are found in possession of like kilos of marijuana, then there is no criminal or civil penalty. No, there's a civil penalty actually if you are. There's a slightly lower thing, but basically, recreational use is decriminalized at this point. What there isn't yet actually are legal places to purchase marijuana. This is because there's a lot of sort of bureaucratic wrangling that has to go on for how a place gets licensed to be a marijuana dispensary and all that fun stuff. And, the legislature will be working on it over the upcoming year. Yeah, and I'm not going to give people advice on how to procure their marijuana. What else do we have? 1 second. My notes scroll into place. That may be it for legislation, unless I missed something. Yeah, that's all I have in terms of legislation. As I hope everyone here knows, there is a primary election coming up in June, or early voting starts 10 days before that. Early voting, I believe, starts June. I don't know off the top of my head. I don't want to mislead you, but it's somewhere around June 12th. Early voting starts. This also means that it is now in the time period where you can request an absentee ballot if that is how you want to vote for this election. Once again, executive order stands that COVID-19 is a valid reason to request absentee ballot. You just mark temporary illness as the reason you're requesting it. And once again, if you live in New York City, you can request it by using their absentee ballot request website, which I would just put in the chat. Finally, our continued following of the travails of the Brooklyn Democratic Party. Most recently, their spat with the Brooklyn Young Democrats, which up until recently was the official youth arm of the Brooklyn Democratic Party. But the Brooklyn Young Democrats and the party boss, Rodney Spachat, have had some beef between them for various issues. And as last month I mentioned that the Brooklyn party attempted to decertify or disempower the Brooklyn Young Democrats. They don't actually have the authority to do that. The Brooklyn Young Democrats are chartered by the New York State Young Democrats. So they can't just take away their power in the middle of this term. But what they did do is, typically when a organization is getting rechartered by the New York State Young Democrats, when a county Young Democrats organization is getting rechartered, they need to get a letter from the party boss of approval. Usually this is pro forma. Our party boss here in Brooklyn did not provide them this letter. So for the first time in New York State history, the New York State Young Democrats chartered a county Young Democrats organization without the party boss approval. And the New York State Young Democrats voted unanimously, their executive committee voted unanimously to continue the charter of Brooklyn Young Democrats. Additionally, as I guess a way to get back at them or take over, the Brooklyn Party filed for incorporation a group called Brooklyn Young Democrats that was just incorporated within the last month. They claim that this is now the official Brooklyn Young Democratic organization, and they sent a cease and desist order to the existing Brooklyn Young Democrats for continuing to use their name. They've also put out a publicly threatened any political candidate who advertises their endorsement from the original Brooklyn Young Democrats. They've threatened a lawsuit against them for claiming endorsement from the Brooklyn Young Democrats. And that's how our local Democratic Party is getting on these days. And that's all I have for political and advocacy issues within the past month. If anyone has anything they would like to add that didn't get mentioned, please raise your hand and we'll give you a minute or two to talk about it. All right, seeing no one, why don't we move on? Sarah, back to you now.
All right, so this afternoon, we're going to be hearing from members of the Campaign for Health as well as labor activists for New York Health. Many of you are familiar with the New York Health Act, but we're waiting for them to come on since I said 4:30. Let's review. So the New York Health Act is a piece of legislation that would provide healthcare, improvement care for all, for every New York State resident, regardless of employment and regardless of immigration status. We would ideally love to see Medicare for all passed at the federal level, but there's a lot of discussion that if New York State does manage to pass this bill, we could provide a nationwide model for with Medicare for all, similar to how Mitt Romney's health reform in Massachusetts laid the way for the Obamacare to be implemented nationally. the New York Health Act has actually passed the Assembly for the past decade, not 2 days. It had previously been held up in legislation by the state Senate. We have reason to believe that that may change in the near future. But this does mean that even if it passes the Assembly and even if it passes the state Senate, that Cuomo could veto it. We have a supermajority, could be overrun. But for me personally, as someone who works in the healthcare industry, a bigger concern I have is that we could put effort into fighting for this bill to pass. Then there's 2 years until it's implemented, so we'll have to remain organized because there's a lot that could change in the next 2 years. And also the passage of the bill might oppose universal health care to act more strongly in opposition to it. So while we wait for the campaign's person to come on, does anyone have any questions about the bill? All right. I'll also say South Central Brooklyn United for Progress has had a strong New York Health Act working group. We've done a lot of local pro New York Health Act events. We've hosted meetings about it ourselves, including we've hosted educational events at churches. We've taken a whole bunch of street fairs. We're going to be discussing later on in the meeting exactly how we could proceed both at a very small non-committal level to much higher up actions. What else? Also, just should you be wondering why Medicare for all, definitely get in touch with us because there's a lot wrong with our present healthcare industry and ways of administering healthcare. All right, since we have a minute, I'll tell you a story from work real quick. So as many of you may know, I do work in the healthcare industry as a lower level administrator. I make sure that at this point, I make sure procedures happen for a major hospital, which includes making sure insurances pay for the procedures and or any required testing. Recently, a younger doctor started working at my facility. I'm brand new, just graduated from medical school, younger, but age. And he told me, you know, his patient mentioned that he was concerned that he has necessary surgery coming up, but how is he going to pay for it? And this brand new doctor had said, well, you know, insurance is going to cover it. Why are you worried about that? So I did get to explain to him something many of us are no doubt familiar with, that just because your insurance covers it doesn't mean it doesn't cost you anything. There is copays, there's deductibles, there's co-insurance, there's out of pocket, and you may well be told your procedure is covered and then asked for full cost of your procedure if you have not yet met your deductible. So that's why we organize. It's one of the many reasons. Additionally, since we were on the topic of funding excluded workers, New York is home to many undocumented individuals. They often do not qualify for most Medicaid or financial assistance programs at major hospitals, which is unconscionable when they have kept our city running. So for those reasons, we are for healthcare for all New Yorkers, regardless of their status, income, job, all of that. And I see Yu Ling from the New York Health Campaign is here, so I will turn it over to her when she is ready.
Hey, everybody. Sorry to be here just barely on time. Thanks for having me. I'm going to go ahead and share my screen. Oh, I can't. Can you help me? Can you make me a co-host?
Sure, give me 1 second.
Thanks.
Okay, you should be able to now.
Okay. And I'm a very nervous speaker, so it's hard for me to pay attention to the chat and sometimes to pay attention to the time. So I'll need your help. Feel free to verbally interrupt me if I'm going long. Okay, let's see. So thanks for having me. I just want to give a shout out to my co-director, Ursula Rosem. She lives on Haudenosaunee land, colonized as Syracuse, New York. I am based on Canarsie and Muncie Lenape land, colonized as Brooklyn, New York. I'm in the Greenpoint area. So thanks for having me in South Brooklyn. And we also happen to both be on the New York State Poor People's Campaign, New York State Coordinating Committee. So we are very grateful also for the Poor People's Campaign, like being such a huge influence on our theory of change and for being huge partners in this fight. So as most of you know, I recognize most of you. So you were all part of this history that we made in March. We reintroduced the New York Health Act with majority support from members of both the New York State Assembly and the New York State Senate. And just last week, the New York Health Act passed out of the Assembly Health Committee. It will go on to the Codes Committee and then the Ways and Means Committee in the Assembly. And our understanding is that whatever passes out of Codes passes out of Ways and Means, often on the same day. Then it's up to Assembly Speaker Carl Heastie in the Bronx to bring it to the floor for a vote. And AM Heastie has brought it to a vote, and the New York Health Act has passed 4 times in a row with at least 2-to-1 margins. This was between 2015 and 2018. And the state Senate will also have to pass the bill through the Health Committee and then likely the Finance Committee, which is the equivalent of the Assembly Ways and Means Committee. Then Senate Majority Leader Andrea Stewart-Cousins has to allow the bill to come to the floor for a vote. And so far, our understanding is that both Heastie and Stewart-Cousins still need to be pressured to see the New York Health Act as a priority and then therefore bring it to a floor to a vote. Then the bill goes to Governor Cuomo. He has 3 days to pass it or to veto it. Nothing has changed in his stance. He's still a champion of austerity. He's still not investing in public health or anything else for that matter, despite our, the most progressive budget that New York has ever seen. It's all relative, right? Great wins, still relative. We put Lieutenant Governor Hochul on here, maybe soon to be Governor Hochul, I don't know. But just to say that we haven't seen her take any public stance on single payer so far. Whereas Governor Cuomo has said, he kind of hides behind the excuse of, well, I believe in it in the federal level, but not at the state level, that kind of argument. So we haven't seen Lieutenant Governor Hochul say anything about single payer so far. So bigger picture schedule, we've made it through the New York State budget cycle that happens every January through April, and now is the time we fight for everything that is not tied to the budget, like the New York Health Act. So the legislative session ends on June 10th. We have 6 weeks to do that. So how do we get across the finish line? We love the National Union of the Homeless. They say you only get what you're organized to take. So we organize. And we organize by working collectively and in coordination. So again, I'm super thankful for y'all to be having us talk about what our strategies are. Something that has been impressed upon us is that this is the critical time to show off the big, vibrant movement for universal guaranteed healthcare. Because that's what's going to move Andrea Stewart-Cousins and Carl Hastie. And also to speak about the New York Health Act as more than just health policy. It's, for example, it's about wealth redistribution and eliminating systemic extractors of wealth, eliminating the health insurance corporations. That it's also about racial justice, that we can't have racial and economic justice without single payer healthcare. And that Albany will never be the same as we rebuild from these devastating crises, and that we have to be loud and public everywhere we go about how we can't have a just recovery from this pandemic without guaranteed universal healthcare. But that also, with or without the pandemic, the New York Health Act would improve our lives and also our ability, everyone's ability, to reimagine how to thrive in all parts of our lives. So it helps us get closer to ending homelessness and overdose, closer to responding to crises with care instead of police violence, for example, closer to having racial and economic justice. So I wanted to cover a little bit of our theory of change just to have a good foundation before we get into the kind of more practical ways to plug in. One major thing is that our work is rooted in our stories and story-based advocacy. It's rooted in building leadership to grow the movement and also in relational organizing. So speaking to people that we know, because we have the most credibility with the people who know us already. And those are all in service of growing the movement, because we know that even if the New York Health Act passes tomorrow, that's when the real, we have to fight even harder to make sure that it's implemented the way that we intended it and for the people that we intended it for. So we do acknowledge that there is much immediate and acute organizing to do, but we want to, as much as possible at every decision that in our organizing, ask ourselves, is this building the movement? Because it is really easy to get caught up in electoral politics, in getting the next co-sponsor, in organizing event after event. These are important, but we try to bring it back to, is this growing the movement? Because again, we're going to need this in long-term fight to make sure it's implemented the way that it should be. And the bill is intentionally meant to pass upon the human rights principles that it was written upon back in 1992, and then go through a negotiation process of making all the details explicit. Besides that, it's apparently not uncommon for legislation to not be explicit about tax brackets and financial mechanisms. So that's also just something to keep in mind. So our stories expose and counter the false narratives that justify the status quo. Our stories build solidarity among one another and across differences. So we don't want our healthcare to be dependent upon any one political party or any one demographic. We want it dependent upon the people's needs, especially the most marginalized, the most vulnerable, right? So this is why, again, the long-term movement building. And our stories also give us clarity about what we're up against, who our enemy is. Here's an example of stories and building leadership. Very basically, so Drew's from Syracuse. They suffer from chronic illness. They're an essential worker. They rely on their father to remain employed with health insurance. Drew did a sign selfie, joined a storytelling training, then worked with us one-on-one, Ursula and I, to develop their healthcare story into a 2-minute healthcare video. And that's shared on social media. It's shared with legislators. It's shared in presentations like this. And though speaking publicly makes them nervous, Drew has joined several speak outs to share their story as well since then. And Sarah from Buffalo, and just another great example of moving from, sign selfie, storytelling training, recording a video, and speaking at speak outs, and also with media, and also being able to coach others to share their stories. Another foundation of our organizing is relational organizing. So as I said before, harnessing our own personal relationships to affect change, this one-on-one outreach with your friends and family to grow the movement. And specifically that those conversations are meant to lead up to a concrete ask. So just to emphasize that we don't forget about it. So here's an example. For example, the cheese shop in the middle, that's Cold Spring Cheese Shop in the Hudson Valley in Cold Spring. That happens to be an acquaintance of mine. So at the time that we were talking about the New York Health Act, not like a good friend, now a good friend, which is great. But we discussed their healthcare experiences and discussed questions about the New York Health Act they had. They signed the petition, have since become super advocates, especially as business owners. They even designed these huge window decals that you see in the picture in the middle. And they also got several more of the businesses on their main street. All the businesses are on Main Street in Cold Spring to sign on to the New York Health Act. They've testified at public hearings as well. And they're making headway with their local Chamber of Commerce. And then in the bottom left, you'll see Beacon's Closet. So I did not have a relationship with any of these owners. So here's an example of, well, we still have to do some cold canvassing and cold calls. I just happened to walk to their store. It's like, I don't know, a 10-minute walk from my place. And they signed the petition after a few conversations. And then they did the relational organizing of introducing me to like 5 other businesses that 3 out of 5 of them eventually signed on to the New York Health Act. So there's that type of relational organizing as well. Another foundation that I want to emphasize is that our work is to build a leaderful movement. And so, for example, I was not the only person that could have given this presentation today. I think there are folks in this room that could have done this today too. And that's what we want. One example I like to bring up is the Northwest Bronx Community and Clergy Coalition. They helped make the 2019 public hearing so successful. The relationship with them started out in, I think, 2017. We did a Power to Heal screening and discussion relating the New York Health Act to racial justice. They couldn't even make it to that screening, but were interested that we were even talking about racial justice as part of the New York Health Act. And we had one conversation. They invited us to do a New York Health Act 101 to 100 of their members. And then we had smaller meetings with just their Health Justice Committee leadership, maybe a group of about 5 to 7 people. And from there, their leadership, Health Justice Committee leaders, then took over doing the New York Health Act 101s, the kind of like train the trainer. And now their leadership, they've done their own storytelling trainings, they've done their own events, they have done they lobby with their legislators without very much support from us. They have recorded video stories without much support from us too. And further, like the Bronx hearings, they were so successful. Like a majority of those testifiers were from Northwest Bronx Community and Clergy Coalition. And further, what is amazing is that in the past year or so, it's a long conversation, but they've been trying to speak with their Housing Justice Committee and talking about how the issues are interlocking and why the housing justice movement should also care about the New York Health Act. So that's something also important, which brings me to coalition work and political education. So that's another part of the foundation of our theory of change, is that we have to build coalitions. We can't win this by ourselves. Our solutions, our problems and solutions cannot be siloed. And coalition work, it can mean many things. It can be as simple as a retweet alliance, right? Your organization has a thing going on, we retweet it and you retweet our stuff, and that's fine, that's useful. But what we're hoping for is really that political education piece. For example, if the Health Justice Committee speaking to the Housing Justice Committee and vice versa, and having both of their memberships understand how it's interlocking. Long-term care. So this is here because this was part of coalition building, and also just having conversations. Long-term care wasn't included back in 1992 when the bill was first introduced. Long-term care was included as part of the bill from day one of implementation only in 2019, just a couple of years ago. And this was the result of, at least a year of conversations between disability rights activists, home care, elder care, seniors, and others involved in long-term care, most impacted by long-term care, having conversations with Dick and Gustavo and the Campaign for New York Health to figure out how to include it from day one. This is the coalition work that I think many of you have been involved in, that, we want the New York Health Act, and the New York Health Act makes a lot of these more incremental things moot, right? But we support coverage for all, right? And we support protecting Medicaid. We support canceling medical debt and other things like that are incremental but expansive, but that also the New York Health Act makes moot. But very specific things on the way to the New York Health Act that make our public health system more robust only strengthens our ability to pass the New York Health Act and implement the New York Health Act more smoothly. So I'm not talking about making the ACA more robust, not like that. This is here because, are the slides moving? Okay, there it goes. Everything's related to healthcare as a human right. Everything's interlocking. So this is from Audre Lorde. There's no thing as a single issue struggle because we do not live single issue lives. And so this is part of a great coalition that came together just last month, and just, I think 2 weeks ago now, launched a report about the fiscal responsibility of decarcerating New York, of passing good cause eviction bills for housing justice, and guaranteeing healthcare for every New Yorker. So the New York Health Act was included in this bill package. And what was great about this is that we had press conference launches in both Rochester and in New York City, and then virtually as well. It had strong progressive legislators, both new and old, to the New York Health Act. It had coalition partners, both new and old, to the New York Health Act. It had great media coverage. And in fact, that coverage did not really include any opposition narrative, that almost never happens with the New York Health Act. So this is, I think, we'll be having a few more events through the year, and both the decarceral movement and the housing justice movement plan to keep this coalition going for the long term. Let's see. So this also a foundation that we want to remember in all of our organizing is that this is anti-racist work, and that we're doing this for racial and economic justice. And kind of a foundation of that comes from something I learned from Dr. Rhea Boyd, a pediatrician out in Oakland and a public health advocate. She says, racism works to fracture and scatter families and communities. And so for the Campaign for New York Health, healthcare is one major structure that upholds and enables this kind of white supremacy. And so that's why we support the New York Health Act and Medicare for All, to help dismantle and transform the healthcare structure to be more equitable. And we want to create spaces where this political education of rooting our work in racial and economic justice is imperative, whether, no matter what area you're in. On that last slide was also another quote from Dr. Boyd: health inequities arise when certain populations are made vulnerable to illness or disease, and often through inequitable distribution of protections and supports. And so that's another reason, right? We want to dismantle these inequitable distribution of protections and supports. Right now, for example, our current healthcare system is set up as an inequitable distribution of protection and supports. But further, that's why we also want to defund and abolish the police. That's why we also want to cancel rent. That's why we also want to guarantee housing and healthcare and all the things. That is not just health policy. Okay, so getting to a little bit more specific organizing, how to plug in. So we're currently prioritizing deepening the engagement of our supporters. And that means organizations, individual advocates, and legislators, statewide and nationally to a certain degree. We want to move those passive supporters who maybe signed a petition and haven't done anything else, move them into active supporters, because again, this is the time we need everyone to be all out all the time, publicly and loudly, unfortunately, to help inspire people that the New York Health Act is viable and popular, not just the right thing to do. So we're in regular communication with A.M. Gottfried and Senator Rivera, our lead sponsors of the New York Health Act, as well as a few other legislators and partner grassroots organizations to strategize together. And we have agreed, we've identified that we must prioritize pressuring Senate Majority Leader Andrea Stewart-Cousins and Assembly Speaker Carl Hastie. In order to bring the vote to a floor, we need them to see New York Health Act as a priority. And so we talked about, it doesn't just mean, we don't want hundreds of calls just flooding to Andrea Stewart-Cousins and Carl Hastie. We want to understand what makes them move. Well, it's other legislators, their colleagues, right? It's grassroots energy, unfortunately, relentless and exhausting grassroots energy. So we're talking about looking at fund excluded workers as an example, Invest in Our New York as an example, housing justice of the past 3 years as an example. They also respond to media coverage, union collaboration, and their own constituents. So this is a very boring slide, I apologize, but to the point, we are working on creating and developing care champions. So and this is across organizations, individual advocates, and legislators, just to be clear. So we want I'll use legislators as an example. We want the legislators to be relating everything to the New York Health Act everywhere. And so right now I can immediately think of, well, Dick Gottfried and Gustavo Rivera, Carinas Reyes, Jessica Gonzalez Rojas. Those are some of the Jabari Brisboard. Those are some of the people that, you know, we do see all the time relating the New York Health Act to everything and wearing their masks out in public, whether it's a healthcare event or not. So that's something we want to grow more legislators, give them more opportunity to do things like that and support them to be able to do that. Engage co-sponsors. So these are the folks that maybe they're co-sponsors, but they're not just on paper. They're not care champs, but they will do at least one thing on the New York Health Act. So we move them closer along the path to become care champions. And so the one thing they could do is, like, you know, maybe when the next time we meet in a lobby meeting with, for example, Senator Cooney, we met with him once, we talked, he decided to co-sponsor the bill. We talked with him again, and they decided, okay, yeah, I'll do an event with you. We gave him an opportunity to participate in a town hall where he was able to speak his story about his mother and long-term care needs that is part of the reason why he believes we need the New York Health Act now. So giving other co-sponsors an opportunity and spaces to become closer to becoming care champions. Another example that I want to give there is an op-ed. So giving a co-sponsor, like a lot of co-sponsors like, yeah, I've signed on the bill for many, many years. And for me, that's not enough. It's like, great, thank you for that. But will you do an op-ed with us? Will you host and organize an event with us? Not just show up to an event, things like that. Get more co-sponsors. So we made history, but it's true that we have 85 out of 149 assembly members. That's lower than in years past. It's still a good majority, but it's lower than numbers in years past. So we still want to up that number of co-sponsors. In the Senate, we have 33 out of 62 senators. It's a majority, but only by one or two. One. So we would love to strengthen, you know, we want more Senate co-sponsors. It's just that we're prioritizing more heavily, like engaging and shoring up the support from our supporters. But yes, we keep the conversation going with our targets to get them to co-sponsor the bill. What are their questions and concerns? What opposition do they face? How can we support them in responding to like concerns that they are coming up against? And also, what are their priorities? What are their other legislative priorities? Because again, we can relate the New York Health Act to almost every issue. Then we don't let the troublemakers off the hook. We still go through the formalities of, for example, speaking with Senator Gorn on Long Island, just to make sure that we're monitoring the situation. Maybe new things come out in new conversations. Keep hammering them on what their questions and concerns are and giving them the answers. What are their priorities? Again, because maybe we can find new ways to relate to them. And also just so that they know that we're still here. And then bringing in new people. So I know I'm over time now, and I'm just going to give some, like, here's how you can plug in right now, our priority plugin. Join our weekly phone banks. They're every Monday and Thursday. I'm sure that we can get the links to you. And if you haven't already, get your businesses and your organizations to submit their memo of support. These are really important to legislators. We've been told by many that this is what people pay attention to, and especially when they come in as a flood. So we have a template to help you get your memos of support out there. And when I say businesses includes worker cooperatives, freelancers, nonprofits, and churches as well. And the last thing is our remote organizing team. So again, it's got to be collective, statewide, and coordinated. And so that's why we have these structures for you to join in to these various teams. Yeah, we have a lot of need for people to help us statewide to get all the things moving in these last 6 weeks. So I'll end there.
I think we have time for 1 or 2 questions if anyone has. Blake, you have your hand up.
Yeah, so thank you very much for that presentation. That was very good. I'm running for city council in the 40th district in Flatbush. And one of the questions I get asked all the time, because I'm a big supporter of the New York Health Act, is how much is this going to cost? If someone's already paying for health insurance or their employer is paying for health insurance, what would someone making $40,000 a year or $50,000 a year, what would they pay for health coverage? Like, what would a family of four have to pay for health coverage, and what would they receive?
So I would say that both conservative and liberal economic studies show that at least 90% of New Yorkers would save money under the New York Health Act. So that's something I would bring up first. And also that we do have models, and that's what the RAND, like all these economic reports, right? Economic reports are based on models. That, for example, someone who makes $50,000 a year, the employee would pay $38 a month. The employer would pay $150 a month. Someone who's self-employed, right now, they pay both employer, employee, they would pay $188 a month. And the important thing to note about that is this is not only does it cost at least 90% of New Yorkers less money, but for example, for business owners, it's predictable and sustainable over the long term, as opposed to what we know about private health insurance is that the premiums keep increasing every year, year after year. Those are just a couple points that I would bring up. Does that help you, Blake?
It does. So would that be complete coverage? Would that be primary care and healthcare?
Yes, sorry. So yes, what is super exciting is that we can cover everyone and comprehensively for less money than we spend now on healthcare. Than the state spends on healthcare, then at least 90% of New Yorkers spend on healthcare. So it covers anything that Medicare, Medicaid, and any state employee plan covers, for example, as a baseline. But yes, it covers mental health. It treats your eyes, your ears, your teeth, your mental health as part of your body and well-being.
And what happens if you travel out of state and then you need medical care across state lines?
Yeah, that works a little bit how it works now, except you're only dealing with one New York Health Fund. So if I go out of state under the New York Health Act and I get care somewhere else, and that hospital just instead of responding to whatever 100 different health insurance companies, they just write to the New York Health Act, and the New York Health Act responds with reimbursement.
Right. I believe Rosa is next. Rosa?
Thank you. Hi, thank you. My question is with regards to something I saw on one of your slides, Yuling. First of all, thank you so much. That was a great presentation and packed a lot into a very short amount of time. My question is that one of your slides mentioned navigators, how the New York Health Act would help navigators reach, I think, New Yorkers that need more outreach. So I have my own assumption. I want to know what that means.
Oh, sure. So right now, navigator, like a lot of people and our opposition talk about, well, we don't need to overhaul, we don't need single payer healthcare. We just have 5% of New Yorkers who don't have health insurance, and they just, a lot of those people just don't know it. So we need to pay more navigators to help reach those people who don't realize they're eligible for Medicaid or this program or that program. Well, the New York Health Act kind of makes that moot because everyone's covered. You don't need to, it doesn't matter. Are you sick enough? Are you poor enough? Are you an immigrant enough? Are you American enough? None of that matters. You just have to live in New York State. So we support having funding for more navigators right now because we want to minimize the amount of suffering, impoverishment, and death. But ultimately, the New York Health Act makes that moot. Did that make sense?
Yeah, absolutely. Thank you so much for clearing that up. That's really interesting.
And if we have time for one more, Borough has had his hand up.
Hi, can you hear me?
Yes.
My question is a very general one. I'm worried about the influence of Wall Street funds and insurance companies threatening to withhold payment to the politicians' funds for running for office. How big a factor is that, if it at all?
So our biggest opposition is and will be the well-funded private health insurance corporations, right? And that's why we emphasize building this long-term mass movement so that we can fight and that the people are stronger than than the money. I strongly believe that. So I don't want to underestimate the health insurance corporations at all, because they are the biggest opponents and they do have a lot of money. But the politicians, if we have enough constituents in every district, the politicians will eventually have to listen to the people. So that's also part of my theory of change. That's a very general answer. I understand.
Thank you.
Oh, but part of that is also, you know, we don't want a diverse movement just in like race or age or income, right? It's yes, multi-race, multi-faith, multi-ability, multi-everything, but also in that it includes organizations, for example, that are multi-issue, not just people who care about health policy. It includes people who care about housing. It includes people who care about decarceration. And when we saw that kind of with the Invest in Our New York campaign, I think is probably the most recent example where that helped immensely, and unfortunately is necessary, that kind of relentless and exhausting action after action after action involving every person in order to move politicians to finally do the right thing. Yeah.
If we have time for one more question, Laura had asked in the chat what the difference is between federal single payer and state single payer, since Cuomo and a number of other opponents to the New York Health Act consistently cite that line.
Oh yeah. So for me, I definitely believe that anyone who says, well, we can't do it, we should do it at the federal level, so I don't believe in the state level, I think that's an excuse to keep us divided and to like distract us. To answer the question, what's the difference between federal single payer and state single payer? So there's a difference between the House Medicare for All bill and the Senate Medicare for All bill. Unfortunately, the Senate one's not as good yet as the House one is working on that now that the budget reconciliation. Anyways, basically, my answer is very basically that there's not a difference. But both the National Medicare for All movement, which we work with closely, they also believe that state single payer is the way to go. That doesn't mean we stop fighting for federal level Medicare for All. That just means that state level single payer, we think that we can make Medicare for All nationally a reality by passing it state by state. And there's a precedent, right? We can look to Canada as passing it province by province. I'm sorry, that wasn't like a coherent, complete answer, but I hope that helped a little bit. And I know we might be out of time, but if there's time, I have a question for everyone in this room. How do you want to plug in to this work? That's actually my most important question, but I understand if the agenda has to move on.
All right, so I'll answer while Borough President candidate Reynoso is here waiting. One of the things that we have been working on as a group, we've interviewed a lot of the city council candidates who are running for office throughout Southern Brooklyn. As part of our interview process, we have asked them to sign the New York Health Act pledge. I'm planning on talking about this a bit more in depth at about 5:30, 5:45, but one of the things we're hoping to do is these candidates have all signed a pledge. Now we'll ask them to send out an email in favor of the New York Health Act. Marian had come up with a wonderful template on that one. And then if they're able to and interested in hosting New York Health Act events, I would very much encourage them to do so. We're also looking at a few crucial Assembly and State Senate members in Southern Brooklyn who have pledged support, but who have not necessarily hosted a New York Health Act event or sent an email about it. We would like to encourage at the very least the email as well. And we'll be encouraging phone banking, of course. I don't know if anyone else had a vision.
Well, y'all know how to get in touch with me, and Sarah knows how to get in touch with me as well. So I love getting questions and ideas of how you want to plug in, or if you plug into the structures we've created. And I want to thank I mean, so many of you in this room have been in this fight for many years.
Yes, I'm wearing my shirt now, actually.
Yeah. And a big special thank out to Marion also for being in this fight and like, you know, doing the things when we're like, we don't have time for that. Like she, you know, you all are stepping up and it's like a really, there's only 2 paid people in this whole campaign. So we're so thankful that we have this beautiful movement. Okay.
Awesome. Thank you so much for your time. And now candidate Reynoso, when you are ready, thank you so much for your patience. You may begin.
Okay, so I don't have any instructions, so I'm guessing.
Oh, yeah, sorry. Let me introduce him.
Sorry about
rather
that.
than just throw you out there. You know, we as an organization are not doing officially endorsing in the borough president race, but we are encouraging, among other office spaces, we're not endorsing in any race this year, but we mostly just looked at city council races to endorse in this year. But for borough-wide and citywide races, we are very happy to have candidates come talk about why they're running, you know, what their platform is, what they hope to accomplish, and you know, especially if their ideals fall in line with our group's ideals. And you know, I am a big fan of Councilmember Antonio Reynoso, having followed him for a lot of his city council career. And so I'm happy that he could join us today to talk about why he is running for borough president. So with that introduction, I should say that you know, he represents the 34th City Council District, which is Bushwick, Ridgewood, and Williamsburg, I think. So now with that, Councilman Reynoso, why don't you?
Thank you so much. Thank you so much, David, for that, and Sarah. Thank you so much for letting me be here with you all, and extremely excited because South Central Brooklyn, I guess, is something that I really want to have like a deep and thoughtful conversation about. So I'll give you a little bit about who I am. I'm Antonio Reynoso. I'm a council member of the 34th District and a candidate for Brooklyn Borough President. My parents are immigrants that came to this country extremely poor. So welfare, food stamps, Section 8, Medicaid, you name it, my family had to take advantage of just to give us a fair shot. I think I'm standing before you here today as a council member, but also as a candidate for Brooklyn Borough President because of what government did for the poor. And I want to pay that forward. I want to make sure that my luck or the opportunities I got are not luck, but the standard across Brooklyn. I care deeply about equity and not equality, equity. I want to give more to the people that need more. And I want to do that deliberately and unapologetically. But I also want to make sure that I put Brooklyn on the map, or assist Brooklyn to get on the map as the progressive capital of the country and of this world. While I care deeply about doing a little bit of the Marty Markowitz and pushing for the best cheesecake, the best bagels, make sure everybody knows where the boardwalk is, and that spring starts when the Wonder Wheel starts, not necessarily when the groundhog tells us, is all the things that I want to make sure I do when I become borough president. But I think what's more important is that we also carry the policy flag, the progressive policy flag. I believe that Brooklyn is the center of the universe when it comes to public policy. I don't want to hear about San Francisco or Seattle doing things policy-wise before we do. I really want to make sure that we set the tone, that we're the model. And that's the type of work I'm trying to bring to Brooklyn Borough Hall. So I kind of want to make this more of a conversation than a lecture. So we'd love to just do like some questions and answers, and would be more than happy to talk about things I'm going to be doing and things that I want to prioritize. So thank you so much for allowing me an opportunity to speak. I'm really looking forward to the conversation.
All right, so I guess I'm moderating this. Sarah, I believe you were first to get your hand up there. So if you want to ask a question of Antonio.
Yes, hi. Good afternoon. Thank you so much for joining us. So as you may have noticed, our group is focused on getting the New York Health Act, a Medicare for All bill at the state level plan passed. We were wondering if you would please sign the pledge to show that you're supportive of the bill. If you would also be willing to do outreach for the bill.
So if I'm not already, I guess, on a resolution in the city council that is pushing for the passing of the New York Health Act at the state level. I'm more than happy to sign on to that. And if it doesn't exist, the resolution doesn't exist, I'm more than happy to introduce it so that we can do that work. I am 100% supportive of the New York Health Act. I'm from North Brooklyn, so you know all my elected officials, Emily Gallagher, Maritza Davila, Julia Salazar, who's my state senator, I believe are all members that are supportive of the New York Health Act. If they are not, I'm more than happy to be an ally in making that as well. I will be more than happy to sign on to it. It's a policy that I support and have no problem doing that. My capacity as a council member, outside of as a candidate of borough president, if you want me to do something, whether it is an email, whether it is a public tweet, or hosting a forum after the election, I'm more than happy to set something up to make sure that we're making the New York Health Act a front and center issue come 2022. So 100%.
Great, excellent. So I have put the link to the pledge in the chat. We'll also send you an email as well. I think we actually had discussed this with you previously, but maybe didn't follow up since you're not on our list of people who signed. Thank you.
I'm surprised. So yeah, I will sign on. I don't have a staff member on the call, but I'll make sure that hopefully today, worst case scenario, tomorrow, I'm signed on. Thank you, Sarah.
Yeah, thank you, Sarah, for that. Blake, I believe you're next up with a question.
Hi, Antonio. How are you?
I'm doing well. Thank you for asking. How are you?
Hi, thank you. So I'm Blake Morris. I'm running for city council in the 40th district in Flatbush. So there's a lot of concerns about community boards throughout the city and in particular Brooklyn. So I'd like to know, how did you select your community board members in the 34th district? And whatever that process was, if you could tell us, and then are you going to continue that process as borough president, or are you going to have a different process?
Yeah, so I think the current process, Blake, that exists is somewhat dictated by the borough president, and we have very limited, wiggle room. That's like doing some like participatory work towards the establishment of like who's going to be on the community boards. So I do want to say that it comes from the top. In this one case, the work that needs to happen to ensure a more diverse and more informed, and when I talk about diversity, I don't only mean racial diversity, religious diversity, gender diversity, age diversity across the board. It's something that I'm going to put front and center on the community board. I don't know if you guys have seen my op-ed, but I am probably going to be the member, the candidate that is going to push for the most significant reforms to community boards. I think there's huge issues with community boards, and I think we need to start dealing with them in a more serious way. So I'll start by saying I am arguably responsible for all the diversity in community board 1 and 5 that I represent. Community board 1 is a mostly white populated community board, even though the community or the neighborhood is more diverse. We represent about 38% of the population is Latino, but less than 20% of the community board participants are Latino. Most of community board 1 is renters, but the community board members are homeowners. The LGBTQ community is also of concern. I was the one that put in all the LGBTQ folks, all the Latino folks, all the African Americans. The first NYCHA appointees were also mine. And it's unfortunate that the borough president and the council member that's in that district mostly focused on making sure that they appointed folks or put folks that are more politically affluent or have political relationships with them, as opposed to folks that can actually move the needle in a positive way on issues that are extremely important. So my goal is to remove the politicization, sorry about that, of the seats and move towards something that is more resume worthy, something where we're going to have interviews, and we're also looking to do training. We're going to do regular training related to transportation, education, land use. So we have a well-informed population of folks that are going to be participating in the community boards. So again, I don't want minority elected officials to be the only people that are responsible for all the diversity in a seat. So a lot of changes that are going to be coming, Blake, from me. And if you want, I would love a follow-up so I could get into more detail as to like what you want to hear. But again, I want to thank the volunteers that are doing the work on community boards, but I don't think that they're necessarily fulfilling the goal or the intention of the creation of community boards, which is like civic engagement, allowing for a more local representation in decisions that are important to the city.
All right, thank you very much for the answer, Antonio. Marion, I saw you next, and then Bonnie after you, and I think that we're probably up to time after that. We'll see.
Hey, Antonio. I saw you on Thursday night, and it's good to see you here again. And to hear
Marion,
that
are you following me, Marion? Is that what's happening?
Of course I am. So I'm real glad to hear that you'll be the progressive policy champion. And on Thursday night, you talk about the playground where you take your kids to, where there are more pavers than plants.
Yes.
Right. And so we all know that a lot of existing city policies contradict each other. They actually go against life rather than support life or sustain life. And right here in Central Brooklyn, in Council District 40, there is a big publicly owned site that nature had vacant, that nature has retaken. And the city, of course, is planning housing development. Now, when you're elected as borough president, I'm wondering can you talk about how you would bring all parties together, the agencies, the people, to really discuss and collectively decide what is good for the people of this part of Brooklyn, and what's good for the land, and what's good for the generations to come.
Thank you for that question, Marion. And I agree with you. I think that there's a lack of comprehensive planning that happens in the city of New York. We have a developer-driven planning process that currently exists in New York that has left us into like gentrification and displacement at an all-time high, rents at a level where middle-class families can't afford it, a homelessness that has low-income families having to be in a state of support by the city of New York, mandatorily and appropriately, and we have a crisis. So, Marion, what I think would fix that is comprehensive planning. What we need to do is allow for every single community in the entire city of New York to tell us where they think they can see responsible development happen. Instead of having the burden of building ourselves out of this housing crisis fall on just a few communities that are mostly Black and brown, we can have a conversation about how Canarsie, Midwood, Bay Ridge are part of the conversation of growth. What we've done for a long time is exempted certain communities from being a part of the conversation of development in our city, and we have to change that. We need to keep growing. We need to do it responsibly. We can't do it unless everybody participates. So, Marion, what I would say is, in my process, the community board would be empowered with putting forth a plan of where they see appropriate growth happening in their district. But I would also ask them or task them separately to show us where the city's capital plan should be working. We shouldn't leverage development with the need for new infrastructure from the DEP, transportation, schools, and so forth. So my comprehensive plan, again, would have the community boards tell us where they think development can happen, but also through a needs assessment, tell me where we need to take care of infrastructure issues and items like what you just talked about, where I don't know if it's a wetlands or it's a marsh or what it is, but it seems like there's a nature preserve somewhere in the 40th district that is very meaningful to that population. And we could have had a discussion about whether or not there's more value added to keeping that there as opposed to development. And maybe there would have been other areas where development could have been possible, so that we're not talking about the fact that we're NIMBYs, but actually that we want responsible development to happen in responsible locations. That cannot happen under ULURP. It cannot happen under the current systems that we have, and it could definitely not happen under the current mayor. When I'm borough president, I'm going to be making a comprehensive plan front and center. I am not a member deference elected official. So while right now I think it's important that we support local elected officials in the determination or in the self-determination of their communities, as a borough president, I don't have that responsibility or that mandate to respect member deference, and I will be working independently to ensure that I'm doing what's good for the borough, not good for a developer.
So how is the approach going to be better than the 971A, whatever that term is?
Yeah. So the thing here, Marion, I want to be perfectly honest. We have a very limited charter mandated responsibilities as borough presidents. We do make recommendations on land use items, and I will fight alongside every single community where they think it can happen and it can't happen. But for the most part, the most powerful thing that the borough president has at their disposal is the bully pulpit, Marion. I'm going to make sure that I use my voice to speak up for communities and to let people know what I think is happening in a positive or negative way. And again, I'm going to be looking for community-based processes for decisions to be made. I don't want this like top-heavy council member dictated process or developer dictated process to be how we move forward with development in the city. And when I become borough president, that's what you will see, the bully pulpit. You will have a partner in a borough president that will stand with community where they think it's inappropriate for us to develop.
Thank you.
Thank you.
All right. Thank you for that. And looks like Bonnie, you're going to have our last question for Antonio.
Great, thanks. So my question actually kind of builds really nicely on Marion's question. Before the pandemic, the borough president started this program called Breaking Bread. I think that's what it was called, where they were kind of creating this opportunity for people in different communities to come together and have dinners or meals, whether it was in their home or at a community center or something like that. And so it was kind of put on hold during, COVID, and I just got some sort of email that they were kind of trying to put it back together. But my question is, there's a lot of talk about like bringing the community in, but, what is your vision of how to bring such disparate communities together so that you're not having conversations within discrete communities, but having conversations across communities?
Yeah, thank you. So Bonnie, the foundation of the work that I do all comes off of a foundation of equity. Equity is extremely important to me. So first and foremost, I am very deliberate and unapologetic about the fact that I will be spending more time and resources in neighborhoods that need more time and resources, and asking those that are more, politically affluent or have the resources necessary to take care of the communities to take a step back and allow us to improve the quality of life of these neighborhoods so it affects others. So that's like the first part of what I do. But the second thing I do is I'm a big nerd, I'm a big policy wonk, and I care deeply about comprehensive planning. That's very important to me. And what you're talking about and bringing people together, finding out where the common denominators lie, and stopping this this assumption that Brooklyn is one borough with many little cities in it with very different opinions. I think that there's basic things that we all agree on that can bring us together that are more important than what keeps us apart. And I actually think that this Breaking Bread initiative is a very smart initiative, and it speaks to our wants and our ability to bring people together to have these conversations. So it's something that I would be very interested in expanding or doing. I don't know much about this. Is the first time I'm hearing about it, Bonnie, and just listening to it, the premise of it is extremely, it's a positive thing. It brings me joy just listening to the idea of it. So it's something that I would expand on. I am not one to divide Brooklyn. Coalitions. When I would first run for office, Bonnie, the number one question people ask me is, can you build coalitions? I feel like now, when you run for office, it's almost like, can you help us destroy, as opposed to it's like, can you help us build? We've changed the narrative right now is really about breaking things down instead of building things up. I was born from a political time where development, and not development as in residential development, but like community development, building coalitions and coming together was more important than anything in our ability to pass legislation and get things done. So I want to bring that attitude back. I want people to know that we're not divided. We're all Brooklynites. We know Brooklyn is the best borough, so let's make sure that we work together on the things that matter, and make it happen and build. So you will be seeing a more build friendly, and I mean build communities, not build. I want to be very clear. I'm not a NIMBYist, but I care about people's opinions as to what their communities look like. But for me, it's not about breaking things down, it's about building things up. And I'm really excited to be able to do that and take that on as borough president.
Okay, well, Antonio, thank you so much for coming. We really appreciate you taking some time out of our day. I know you actually were in some of our neighborhoods earlier today. I saw you were up in
Yes,
Park.
yes. So I want you to get sick of me, David. So I want you guys to know very clearly that I've chosen, that I believe that Coney Island, Brighton Beach, Titmus Park, Midwood, and all these areas in South Central Brooklyn and South Brooklyn for too long have been places that just are neglected politically, or people that don't have the political capital that's like comparable to the Brooklyn Heights and Park Slopes of the world. And I want you to know that you matter to me just as much as any other place, and that you're going to get sick of me. I'm going to be in South Central and South Brooklyn, constantly be there, Flatbush and so forth. So I want you to get sick of me, and that'll continue even after I become borough president. You will not be a forgotten portion of the borough. You'll be a place that I will highlight and would recognize for adding value to the greatest borough in New York, that is Brooklyn. So thank you so much for having me. I appreciate you all.
Have a great night.
Okay. Thank you so much. Take care.
All right, so while we wait for our last speaker, Naomi Zuda of the Labor Activists for New York Health Group to call in, I'm wondering if I could share my screen now to get us started on the project I discussed a little bit earlier, if that's all right. And here we are. Okay. So as many of you are aware, many of you were helping us with this, actually. We interviewed a lot of the numerous individuals who are looking to represent our neighborhoods in city council. A number of them signed the pledge to support the New York Health Act. So Marion had put a lot of work into creating an email template that these candidates can send out to get the word out about the New York Health Act and build support. We would like you to please consider being the point person for one or two of these candidates. That way, you have to follow up with the one person, make sure that they send their email, answer their questions, and then we can have a better idea of what we can accomplish. So I will go first, since Blake had actually done us the courtesy of reading my mind earlier and talking about the information he would like to have about the New York Health Act. I will be the point person for Blake's campaign on this.
Should we just name any, name the candidates that we can sign up for?
Yes, exactly. Just pick, one or two. It doesn't have to, the idea is that we all pick someone, so it's not going to be an unmanageable thing. And you could drop it in the chat as well, and then I'll add it to the spreadsheet so we have an idea of who's accountable for what. And then I'll also email you on the exact template, and you can feel free to make updates on your progress through there.
Sarah, if perhaps you could make your screen bigger so people could see those who signed the pledges. And I would encourage anyone who's in touch with other candidates who may not have signed the pledge to have them sign the pledge now, and also to reach out to their constituency as well as the political associates about the New York Health Act, just like what Yuling was saying. Why don't you read them out, maybe, Sarah?
Yeah. All right, is anyone close with Anthony Beckford and his campaign? Oh, awesome, Julio, thank you. And Rodrigo. All right, anyone in touch with Rita Joseph's campaign that they would be able to talk to her? Yes, good idea.
I mean, I don't have a direct relationship to, I mean, is it okay if I mean, I can understand being preferable, but is it also okay if we don't have a relationship to any candidate?
No, that's awesome. Go for it. I mean, these candidates are looking to be our elected officials. So I would hope that they will be responsive to our requests, particularly when they have already signed our pledge. It'll be a test for them as a candidate to some extent. Yay. I will pick Brandon. Oh my gosh, and look at this, the list is already this much more manageable. So that's why we work as a team. All right. And
Oh, can I actually ask something for the group with regards to this?
yeah, go ahead.
I'm also wondering if for anyone who signed up for a point person or to be a point or to be the contactor, if you could go to our website, our city council candidate guide where we have our videos. And it'll just take you 10 minutes, but if you could rewatch these videos so that I can get a timestamp for when the candidate actually accepted the pledge, because,
We actually have that. I hid the column, but we do have that.
oh, nice.
Yeah, see? I hid it just for the sake of having a clearer screen, but that is there. But yes, definitely watch the videos anyway. In deciding my own city council race, I live in 39. I had definitely rewatched them for sure.
Oh, great. So that will line up with the videos?
It lines up with when they signed the pledge, since that was a Google document.
Okay, so now I'm kind of,
I see what you mean.
yeah, I need help. I just need help in like saving myself time for getting these clips out of our city council candidate interviews. So instead of me like rewatching it, spending the 10 minutes per candidate to listen to identify that moment, because sometimes they say something like, yes, I support this, I absolutely support this because XYZ. It'd be so great if I could just actually get the timestamps from the video itself so that I can compile this much quicker. And the idea is that we're gonna really use that video footage, because we took video of these interviews, and I think we should definitely put it to use in this campaign as well. So anyway, if I need to clarify my question or my ask, please let me know. But I'll put the link to our website where the videos are hosted.
Right, so this largely looks a lot more complete than it did a few minutes ago. It definitely, I'm gonna stop sharing in a minute, but definitely feel free to reach out to us if there's any other candidates that you would like to speak with, and you'd like to get them to promote it. It would be really helpful if they could send an email. It honestly, such a low effort exercise that they could send an email and ask for funds for themselves. There's no downside to that, in all honesty. I would do it if I was running for office. But if they would be able to host an event, that would be even better. And before okay, I will introduce Naomi shortly, since I see you have joined us. Naomi, thank you for joining us this afternoon. Naomi works with the Labor Activists for New York Health Group and has honestly like the most impressive credentials. So thank you for joining us. You can go ahead.
Thank you. Thanks for the intro. Yeah, so, I am a union member, PSC CUNY. I'm an assistant professor in the CUNY School of Public Health, where I teach health economics. And I've been active through New York Progressive Action Network, NIPAN, and the Upper West Side and West Harlem kind of, group of us. So we called GANI, Grassroots Action New York. And we've been getting together with the DSA Healthcare Working Group and the Campaign for New York Health around some of these issues. So, most of what I have studied has been from the health economics side of it, really like consumers of insurance. And I know you guys kind of have the intro to what's good about the New York Health Act pretty down pat. But, speaking of labor issues, so I think this is something that we as a group have been concerned about as people in the city of employees or employees of New York City caucus and union, and also looking at unions more generally in their relationship to the New York Health Act. I guess something to clarify, and also I think that questions will be great. If anyone has them, then I can know a little bit more about what people want to examine more closely. But, I think that there's a real challenge for labor in the New York Health Act. The great thing is that the coverage is better. Like what we've seen with the City of Employees of New York, after you retire even, you end up being really dependent on your union to provide healthcare, and they've promised us these things. So we've been giving up wages or whatever other kinds of perks and benefits you might have in the private sector because of our retirement, because of the healthcare that we get through the union. And still, retirees face the specter of their healthcare being completely privatized. What does this mean? If we go through Medicare Advantage now, instead of having wraparound for the fee-for-service, I mean, fee-for-service Medicare is pretty good. A lot of physicians take it, but it has some out-of-pocket costs, has some deductibles and everything. So what the retiree plan so far has been doing is just covering those out-of-pocket costs with the basic traditional Medicare plan, but moving from the fee-for-service to the managed care comes with a lot of expenses of its own. I've looked at, actually, recently I did a FOIL, Freedom of Information Law request for New York State's Medicaid managed care plans. And what we found is that, so in the state of Connecticut, they have no private insurance companies in their Medicaid program at all. Whereas here in New York, we pay capitation per member per month to a lot of these private insurance companies, you know, Fidelis, United, all of these typical insurance companies. And so they have an incentive to utilize, manage utilization, meaning stop people from getting care, so they can keep as much of the capitation as possible. So what I've found is that, whereas in the state of Connecticut, they don't do that at all. They have traditional fee-for-service. 2.8% of the entire Medicaid budget in the state of Connecticut goes to anything other than paying providers directly. 2.8%. Guess what it is in New York State? It varies, but on average, 13.5%. 13.5%. So this is about $3.6 billion in total, and about $2.7 billion of that is just like unnecessary expense that we wouldn't have if we had the Connecticut model. And so now, sorry, I'm like walking up the stairs to my apartment. The problem with moving retirees to the privatized system is that you're going to incur a lot of additional costs, so that you don't have in the traditional fee-for-service system. Marketing, duplicative record keeping, which if you're just going through the public thing, there's just one place that they hold all of your records. Whereas if there's a bunch of different middlemen, they're carving out behavioral and all this stuff, there's a bunch of different people to pay, and all of that costs money. So when they move to this privatized system, it's not clear where they're going to get all of those expenses from, but it has to come from somewhere. Either the coverage is going to be worse or it's going to cost more. And there's really no other way around that. So, the challenge, I think, so if we have something like the New York Health Act, 100% tax financed, no copays, no deductibles, no networks, all doctors are free coverage, without duplication, without marketing and all that stuff, we save, all of this money that could go towards paying doctors more and giving us better care, better facilities, and more choices. But the challenge, so that's a good thing for labor union members. Their coverage is better and it's more affordable. And it's also not vulnerable to being completely, unilaterally taken from you, even in retirement. But the challenge is just the fact that post-Janus, labor is a great way. Health insurance is a great way to get people to sign up for the union. It seems kind of cynical to say it that way, but I think it's true. Obviously, ideally, labor leaders will want what's best for the rank and file, period. Ideally, our leaders do want what's best for the rank and file, period. But it's still something. I think that's what makes up the primary kind of stopgap for labor leadership in really wholesale signing on to the New York Health Act. People rely on their unions to give them health care, and that's a major win that they've been able to deliver. So if you take that away, in reality, now you guys can focus on wages, on retirement, pensions, on everything else. You don't have to keep fighting over healthcare anymore. You can fight for other things, fight for other workplace condition, rules. In addition to just getting paid more, instead of always having to forego all of those things in the name of just holding on to our healthcare, which is getting more and more expensive every year, in terms of at the aggregate level nationally. So it takes that fight away, but it does also take away something that people rely on their unions for. And I think that's also why it's kind of hard to have a straight conversation, because I'm not sure that it's so easy to come out and say that this is what we're worried about. But at the same time, I can understand why it might be worrying. So it might be a little bit easier, to appeal to rank and file than it is to appeal to people who are in leadership of unions. This thing to pass. We have about 7 weeks, I think, left in the legislative session. So the legislative session is going to end in the middle of June, or June 17th. And it has to get through committee, and then it has to come to the floor for a vote. So it's amazing that we have majorities in both houses co-sponsoring the legislation for the first time, which is kind of incredible. I mean, you would assume that if a person is going to put their name on a bill, they're at least going to vote yes on that bill. And I think for the most part, most of these people, I guess we've never been so close before, and so we'll see what happens. But a lot of the people have been voting yes for years and years and years in a row. So it's very amenable to public pressure campaigns. So basically where we're at is that we need to get these bills through committees and to the floor for a vote. It's passed out of the Assembly Health Committee, and that's the only committee movement it has made so far. That just happened this week. So it's pretty early in the, so the legislative session started in January, but they've been doing budget stuff this whole time until now. The thing is, so now it has to get through codes and it has to get through Ways and Means. The chair of the Senate Health Committee is Gustavo Rivera, and he's a big supporter, and we can assume that he's going to take it out of committee. He's like one of the main sponsors of the bill. So it's codes and Ways and Means. So I think that like the good places to apply, pressure in terms of like when we're really ramping up, like where are we going with this in the next 7 weeks? It's not very many weeks. It's making sure it gets out of committee. That's a potential bottleneck. And then making sure that it comes to the floor for a vote. That's a major bottleneck. And as a matter of fact, if the Senate, the Senate Majority Leader Andrea Stewart-Cousins and the Speaker of the Assembly, Carl Hastie, if they want it to come to a vote, they can get it out of committee as well. So it kind of lives and dies in committee based on really whether leadership are willing to move it through. So I know that in terms of like the Campaign for New York Health and DSA and us at GANI right now, our plans are to really turn up the heat on ASC and Carl Hastie towards the end of the legislative session. So like if you're thinking about the very end point and working backwards, late May and in the first 2 weeks of June, it's going to be, if they haven't brought it to a vote yet, it's going to be flyering their neighborhoods a lot so that all of their constituents are talking about it and calling them about it. Phone banking is already happening in their constituencies through the Campaign for New York Health. And yeah, I think that's the main thing. Phone banking, and they have this new phone banking feature that's like patch through, where if the person is like, yeah, I care about New York Health Act, you can like patch them over directly to their representative's office to make that call. So that's like a newer feature that people are kind of excited about. And so early June, late May, it's them as people. I mean, showing up at their houses, like doing really everything possible to make them feel the pressure, them too as individuals. But that really doesn't happen until the very end, because that's when it's about bringing it to a vote. And then over the course of the month of May, it's about pressuring our representatives who we know are friendly, to not pressuring them, but kind of rallying our friendly representatives to apply pressure to their leadership from the inside. So it's like an inside-outside strategy. We need Yuling's here. So we need kind of powerful legislators who we know care about the New York Health Act to get it on the leadership's radar and to get it out of these committees and to be asking questions. So anyone that we have formed relationships with, even just in terms of, I know you guys have been meeting with representatives and all of that, I think it's so incredible. I'm so excited about where we're at with the New York Health Act and just how many different groups of like really committed people are out there. It's like amazing to see so many of you on this call as well. It's like very heartening. But you know, so all of that work that's been going on with meeting with representatives and everything, I think now is the time to reach back out to those people and ask them, you know, especially identifying who is on what committees and anyone who's on codes or ways and means, asking them, you know, how do they see it getting out of committee and you know, what kinds of pressure we can apply from the outside and that they can also apply from the inside to make sure that it comes to committee votes and then eventually to the floor for a vote. So yeah, I'm just very excited about what we have going on. And let me check this chat. Does anybody have questions that maybe I can help with particularly? A lot of my background is I've been studying kind of like the financial implications. You know, I mean, so, okay, the last thing I had wanted to talk about was people who work in the healthcare industry and especially insurance, coding, billing, these kinds of roles that make up those extra billions of dollars that I saw in my foil that don't have to be spent under a more streamlined public system. So those billions of dollars represent a sector, an industry sector that, you know, in some ways is also kind of under threat from AI and from outsourcing, you know, but also employs many people and including a lot of women and a lot of immigrant women. So, you know, I think the best thing about the New York Health Act on that front is basically the whole labor notion is leave no worker worse off, which is not the case when they're going to outsource the position. You know, it's not the case when they're going to AI the job away. You know, they'll just inform you your job is made redundant, or you know, we've made your position obsolete or whatever, and you know, you can leave at the end of the month. It's better to go through the New York Health Act and actually plan for this transition publicly in a way that represents, you know, the needs of these people who are working. So basically, it sets aside 1 to 3% of the total budget of the bill for incomes of people who are getting laid off and training. You know, I mean, so the RAND Corporation, when they did their simulation, they show that like, because so many more households will have extra money, disposable income, net employment should increase by 2%. Basically, you know, the way that we do it today, the less income you have, a higher percentage of your income goes towards healthcare. And if you think about it, premiums are roughly the same, but if you make a lot of money, that premium represents a very small percentage of your income. So it's kind of like a tax in that everyone has to pay it, but it's a tax that goes to private companies, and it's extremely regressive. Higher percentage of income as your income is lower. So when we go through a tax finance system, the whole point is that we can finance it in a way that's more rational. In fact, the percentage of income you allocate towards healthcare can increase when you have more capacity to contribute towards healthcare. The way that we fund everything else that is kind of a public necessity. So when you do that, you put a lot more dollars in the pockets of people who actually buy money instead of just like saving it and buying like empty apartments downtown or whatever it is. You know, they spend their money on things that they buy stuff at the store, like, you know, all of us. So if somebody gives us money, we use that money. And when you kind of rearrange disposable income in that way, you end up with a lot more people buying stuff and selling stuff. And so employment increases, but it's not a smooth transition. So we know that on net, it is going to be better for the economy because people are going to have more money. And you know what, that's a good thing. But it's not like they're all going to get employed the next day. So we have to have support for the transition. So we know the place we're going is good, but we also know that we can't just leave everything to sort itself out. We plan for that transition. And it's better to do that through, I think, like this public system, as opposed to, you know, just letting the private sector do mass layoffs as they offshore everything. Because we have the opportunity to plan for that. And we do. And I think that's part of, once it gets passed, and we have the 2-year period between its passage and its implementation, where we have to be sure to iron out all of those details. So we know that the principle is leave no worker worse off, but exactly what does that look like? What does training look like? Transition training look like? What kinds of jobs do people want to get? So a lot of it is like, we're going to be doing less administration, but we're going to be doing more provision of healthcare. So a lot of the jobs are just retraining into, instead of billing and coding, like setting up appointments with doctors or being certified nurses assistants or mid-level providers, like physician assistants, nurse practitioners, all of these kinds of jobs that will need to be filled because more people are going to be getting healthcare. There's going to be less fighting over the money about healthcare. So there's a lot of immediate transition on that front, and like a place where that's going to catch most of it. But maybe not everybody wants to work in clinical services, and maybe people should have options in where they go next. So those are the kinds of details that all of the organizing continues around, especially labor organizing for New York Health Act after mid-June, which will hopefully be, it'll be a great problem to have, but not an easy one. So we'll definitely still have kind of like good work ahead of us. Okay, so I think that was all that I was going to bring up, but I'm happy to answer any questions if people have any.
So if we have members here who are currently in a union or retirees, how would you recommend that they leverage that to get the New York Health Act passed?
Oh, who are retirees? I think that a big thing is resolutions. So passing resolutions and sending them to, I think that there is a way to have it attached as kind of like an amicus brief type of thing, but like they'll attach it to the bill itself and sending it to the staffers that you're in touch with, showing that large groups of their constituents want the New York Health Act and want it to come to a vote. And as part of like being able to kind of rally them to pressure for it to get out of committee and stuff. So passing resolutions, that was also something that Dick Gottfried and Gustavo Rivera were bringing up, but I can kind of see how that can be useful. I think that there is a little bit of this pressure campaign that that is more than what, like, sometimes I think what Dick Gottfried and Gustavo Rivera themselves say explicitly in public. They don't come out and say like, we need you to pressure our leadership, but that's effective. And also in talking to, so I was doing some work with the Economic Security Project around a lot of like federal lobbying for this bill that we're coming out with soon. It's like End Poverty Now. It's a really good idea. Anyway, so in talking to them about how they lobby for things like the emergency money to the people was their big thing. And I think that's a lot of where stimulus checks came from. So she was telling me that what they did in the state of, what she used to work in the state of Washington as a lobbyist, was they had something called the Roadkill Caucus, which means this group of kind of moderate in-between senators in the state who, whenever they could, like, they were the kind of like, because they were like the moderate ones from the swing districts, they were the reason the Democrats were in power. That's how they saw it anyway. So they stood between like the Democrats and their losing their majority. And so that caucus became very powerful. And anytime you needed to pass something, you get the members of the Roadkill Caucus to pressure the leadership and say, we need this. And everyone kind of bows to their demands. And so whenever they got stuff passed, that's how they did it. They find inside ways. You need the outside game, but you also have to find inside ways to apply pressure to Senate leadership and Assembly leadership. And that really makes a lot of sense to me, especially given that we have majorities co-sponsoring now. So I think like it's touchy, but it's like ultimately really useful. And so I would say that passing resolutions and demonstrating that these large groups of committed, interested retirees who are already in a union, already doing collective bargaining, meaning that they have a strong, powerful collective voice. So that's a really powerful group to send a message from, to send a message of we like the New York Health Act, we want single payer, we want healthcare, and we want it guaranteed and all of that. So how do we use that powerful voice strategically? I think it's attaching it to the bill, sending it to representatives, like using that powerful voice strategically as part of kind of like a bigger overall strategy. But definitely like getting I think the immediate work of it is getting the group to pass a resolution and demonstrating, kind of laying out their support for it, and then kind of thinking about how to use that, as part of a bigger strategy from there is like the second step.
All right, so if no further questions, it looks like we are at time right now. Thank you so much to everyone, candidates, members, campaign members who came out today to talk about the nuts and bolts of getting the New York Health Act passed. Please feel free to reach out to us if you have further questions, if you'd like to engage further, maybe not necessarily pressuring a candidate, maybe you'd like to help us get someone who's already in office fulfill their promises. We would like to work on that. If you have any local businesses or organizations you'd like to bring into the fight, also let us know. And thank you.
I will add, when I say
and
pressure,
Yuli
I don't
for
mean
your
like harsh, I just mean like mentioning it. But anyway, not to scare anyone. But yeah, thank you so much. Thanks for having me, and thanks everybody for all of your work.
I mean, my day job involves making insurance companies pay for things, which involves a lot of pressure, as you can imagine. There have been times where I've had to call, an hour a day for a month to make sure that I was able to get something to happen. And I get more frustrated when it automatically hangs up on me, but I call back right away because it's more important that they pay for it. And now that I'm mad, I want them to pay for it out of spite, but we can do better. And if you guys want to hear my charming healthcare anecdotes, I'll be here all night. But yes, we need to make a better system, and we can do that as a group. If you only have 5 minutes a day, fine. If you have more time than that, that's also fine. So again, thank you everyone for joining.
Thank you.
Thank you. Thanks everyone.